Did you know the government pays for about 60% of all medical costs? The government pays for the medical care of those 65 and over, the poor, many children, and all local, state, and federal civil servants. Even private employers who provide health insurance for their employees receive a tax deduction, which is a form of government subsidy. Then why is it one of the arguments we most often hear in opposition to a single-payer plan is it would be the largest federal government takeover of any private program? Playing the fear card to the average taxpayer, representatives and senators try to convince us government funding of healthcare is a horrible idea. Wait a minute. Did you know that every representative and senator has government-funded healthcare, and those serving long enough have it for life? The government-funded healthcare they preach is pure evil for you is just fine for them, thank you very much. They have 16 different plans to choose from, all paid in large part by you. And unlike those covered under an employer's policy, they don't have to worry about whether the plan will be around next year or that the premiums will skyrocket. No concern on their part a pre-existing condition will disqualify them from ever getting insurance. No sleepless nights over how they are going to pay for the premiums. No one telling them their medical conditions will not be covered. Thanks to you, the taxpayer, it is all taken care of. I have a proposal. Let's agree that if you have government-financed healthcare, you cannot argue that another person should not have it. Sounds fair to me. If it is good enough for you, how can it be so bad for me? Once we can agree that those who have government-financed insurance cannot argue against it, the system will change. How? Not one of our congressmen could ever argue against it, and we the taxpayers, who pay for their Cadillac healthcare, will be able to get a little healthcare for the constituents who put them in office. Sounds fair to me. Next time someone tells you how much they fear a government takeover of healthcare, ask them who pays for their health insurance. There's a better than 50-50 chance it will be the government.